How does vocal tract anatomy impact speech clarity? Imagine trying to speak clearly with a mouth full of obstacles. Your vocal tract is like a complex musical instrument, and its shape and size shape every sound you make. The vocal tract includes your mouth, nose, throat, voice box, tongue, lips, soft palate, and the muscles that move them. All these parts work together to produce the sounds we understand as speech. When these structures are working well, speech sounds are crisp and easy to understand. But if there are differences or issues in the anatomy, clarity can suffer. The way sound is shaped depends on how the vocal tract resonates. Think of it like a musical instrument. If the shape changes, the sound changes too. The mouth, throat, and nasal cavity act as chambers that modify the sound from your vocal cords. For example, moving your tongue forward or backward changes the shape of the oral cavity, which alters vowel sounds. Rounding or spreading your lips also impacts resonance, making sounds clearer or more muffled. When these movements are precise, speech sounds come out distinct and easy to recognize. Articulation is another key factor. To speak clearly, your tongue, lips, jaw, and soft palate need to move smoothly and accurately. The soft palate controls whether air flows through the nose or mouth. If it doesn't close properly during speech, too much air escapes through the nose, causing hypernasality, which makes speech less clear. Conversely, if the soft palate doesn't open enough, nasal sounds can become hyponasal, sounding stuffy. Proper coordination of these structures is essential for producing crisp consonants and vowels. The length and shape of your vocal tract also influence speech clarity. A longer vocal tract tends to lower the resonant frequencies, which can affect how your voice sounds. Variations in the size of the oral and pharyngeal parts of the tract can make some sounds harder to produce or distinguish. For example, a person with a shorter or differently shaped vocal tract might find certain sounds less clear. These differences can be due to genetics, age, or structural abnormalities. Coordination with your breathing and voice production systems is equally important. Your lungs provide the airflow needed for speech, and your vocal cords vibrate to produce sound. The vocal tract then shapes this sound into recognizable speech. If there's a disruption, say from a neurological issue or structural problem, it can make speech less clear. That's why speech therapists often work on strengthening and coordinating these movements to improve clarity. In speech therapy, understanding the anatomy helps identify what might be causing unclear speech. Therapists may focus on strengthening the muscles involved in articulation, improving the soft palate's function, or addressing structural issues. For example, exercises can help improve tongue movement or soft palate closure, leading to clearer speech. Sometimes, addressing structural abnormalities through surgery or other medical interventions can make a big difference in speech clarity. In summary, the shape, size, and movement of the vocal tract directly influence how well speech sounds are produced. When these structures work together smoothly, speech is clearer and easier to understand. Improving speech clarity often involves working on these physical aspects to help people communicate more effectively.